Hi, today I wanted to talk about growth modulation. I wanted to talk about how growth plays into the treatment that we do for scoliosis. And this is a really important concept, not just with Schroth Method Exercises or PSSE or physiotherapeutic scoliosis specific exercises, but this is also crucial with bracing. So anything that we're doing with treating adolescents with scoliosis non-operatively have to do with growth modulation. So let's talk about what that means and how it actually applies. Before we do that, don't forget to subscribe. It really helps the channel. It really helps us to get good content out there. So click that button and we'd appreciate that. So growth modulation, if we look at the spine, so I'm going to draw a spine here. I'm going to draw a scoliosis spine. So we have a little bit of a curve going on like this. And then we have the pelvis. So hopefully you can see that. We have, we'll call this a right thoracolumbar curve. And the problem is, since we have this curve, the spine is growing. And the spine grows mostly from the end plates of the vertebrae. So here and here, here and here. So these end plates are what grow. And it's interesting because as the child grows, these end plates grow uneven, because on this inside, this space here is not as big as this space is here. So there's more pressure on this side of the end plate and this side than there is on the outside of the end plate. So what that means is, we have a kind of a wedge like this. So there's more pressure here, less pressure out here. So when this end plate grows, it's not going to grow uniformly. It's going to grow with more growth on the outside, this side, because there's not as much pressure there. And that causes the curve to get bigger, because these vertebrae start to be wedge-shaped as they grow like that. So then as we have more of a wedge shape in the vertebra, then we start, you can kind of see how I'm exaggerating it here, but the more wedge shape we get, the more angled the curve gets. This is a big scoliosis curve, but to exaggerate it, this is what's happening. And so what we need to do is we need to even up the growth on the end plates of the vertebrae, so here and here. The way we do that is we put a force that pushes in this way, so I'm talking more bracing right now. So bracing is going to push in on this side, which is also going to open up the inside, the left side of the vertebral end plates, and it's going to allow more growth. So we're going to get more even growth on both sides of the end plate, and that helps to even up the scoliosis curve. It helps it to not progress, and sometimes we can see it reduce as we do that. So bracing is pushing in on this side, trying to open up that compressed side of the vertebral end plates, allowing it to grow better. With Schroth Method Exercises, we're doing similarly. We're breathing. I usually use a little cloud, and we're expanding to the left, trying to get the spine to come more to the left, trying to get the spine to elongate. And we do that with different movement techniques and different exercises to open that up. But the purpose is the same. We're trying to get growth modulation, meaning that if the child is still growing, we can get more even growth out of the vertebrae, and we can get some correction of the curve with that. It's the same idea with VBT surgery. VBT surgery is anchoring here and tethering that so this side doesn't grow, so this side grows more, and that straightens out the curve. So it's all about growth modulation in non-operative treatment. Operative treatment, that's different other than VBT. So keep this in mind as you are doing exercises, either Schroth exercises or as you are braced. The pressure that we need to allow the growth modulation is very important. So bracing for the appropriate amount of time is very important so that we can get that growth modulation, especially at night. When you're doing Schroth Method exercises, it's not just about doing them for a few minutes and then forgetting about your postural corrections. It's about trying to maintain as much as we can so that those end plates grow more even. And so we don't get more wedging of the vertebrae and we get a more symmetrical spine. Hopefully that helps. I don't know if you can see my drawing very well, but it was been on my mind, and I want to share what growth modulation is. It's very important in non-operative treatment, and I think in the future we'll see other techniques to help guide that process as well. So hopefully this was helpful. Hopefully it helps to understand why we're doing what we're doing in conservative treatment. And if you're braced or you're doing Schroth exercises or some other type of PSSE, keep at it, because this is what we're going for. The problem is this is a slow process. So hang in there. You're doing great. If you're looking for some treatment, core strengthening does not do growth modulation. So just a word of advice, find someone who's specialized in scoliosis treatment that you can really get a technique that is a growth modulation technique. And good luck. Thanks for watching. We'll see you next time.